come into my nurse's station. I'm gonna be looking at my MAR and comparing it to my doctor's orders. Checking for any allergies, making sure I got the right patient, the right man, the right dose, the right time, and the right route. And then we're gonna be given cephaloxime, 1 gram. So I'm gonna look in my drug book and look up this med, and I am going to check to make sure that it's a safe dose. I'm also gonna be checking to make sure that for the right rate of administration, and for this med we need to be, we can give it over 30 minutes, and it's going to be 33 drops a minute. So I would make sure that my dose is safe, make sure that it is compatible with my primary tubing, with my primary what I have hanging, and also we check my MAR for any allergy, or check to make sure I don't have any allergies, and there's none. And so at this point I would perform hand hygiene and get my medication ready. And I'd also just go ahead and put on gloves. And I would write all the pertinent information on my label. I would write what drug I'm giving, and the amount, and the patient's name and the room number. So I'm gonna write all that in. Okay. And then I would attach that to my piggyback. Okay. And then I would come in my patient's room, perform hand hygiene, check the site, make sure it's not any redness, infiltration, make sure they're not having any pain, ask the patient to state their name and date of birth. Also, I would check their armband against my MAR to make sure that I have the right patient. Ask the patient, do they have any allergies? Let them know I'm going to be giving cephaloxime, 1 gram, and that it can cause bleeding, and so they would need to let me know if they see any blood in their urine or in stool, and I can monitor their CBC for monitor their hemoglobin, hematocrit, and platelets. So I would educate them on all of that. Then I would go ahead, I already have my label on my drug, perform hand hygiene, apply gloves, get my alcohol, and open my bag. Okay. Open this. Alcohol, this. Discard it in the trash. Okay. And start my bag. Okay, make sure that. Okay. Now I'm gonna prime my tubing.
Now we go into the patient's room.
Okay, I'll kind of hold that up to prime it.
State their name,
And get all the air out.
Check for allergies, ask what they're allergic to anything.
Okay.
Share my medicine one more time while I was in there.
Then I want my piggyback to hang higher. And I also would lower my primary and check for flashback to be sure that we're not having this in the right prime spot. Hang this higher.
My drop rate is exactly
Okay.
33 drops per minute.
Then I'll alcohol this. Get another alcohol, discard that. Get another alcohol this. Okay, and then I would attach this. Okay, then I would open this up, letting this flow. And then I would use my primary line to adjust my drop rate. And for this medicine, it's ordered for 33 drops a minute. So that's gonna be 7 to 8 drops per 15 seconds. So I'd use my watch. Okay, so I've got it set at about 8 drops a minute. Okay, and then I would monitor my patient. Monitor my patient and make sure she's tolerating it well. And then once that's completed, once they received all the medication, I am also while that's running, all my clamps are unclamped, allowing it to flow in. So once my piggyback is done, I am going to so we'll just say that it's done. Catch that. Discard this in the trash. And then I'll raise this and make sure that it's flowing back at the original rate that it was flowing originally. And then I would document how the patient tolerated it in the MAR and also sign my signature. And that would complete the Ivpb administration.